Hello, everyone, and welcome. We'll just be getting started now as everybody else in the audience can come rolling in. My name is Sarah, and I'm the Business and Product Development Associate at Monitio, and I will be moderating our discussion today. So thank you to all of you for joining our webinar. This is a great panel, and we hope you all gain some valuable insights through it. Just to go through a few housekeeping items right before we begin. Just a reminder to keep mics and cameras off during the entire session. This would be really appreciated to minimize any disturbance. Also, we are recording the webinar, so you are welcome to access it at a later date online. And lastly, we welcome questions and comments throughout the session via the Q&A chat box on our Google Meet. So today's webinar is about the implementation of digital technologies in healthcare settings. The goal is to understand more about the challenges of pushing innovation in healthcare. The session is co-hosted by Monitio Intelligence, a Health Canada COVID-19 screening and visitor management software provider, and the Master of Management of Innovation program at the University of Toronto. The MMI program gives students the foundation needed to take on roles which push innovation in healthcare settings through case-based learnings in topics such as management of technology, healthcare innovation, and user-centered business design. Angus Ho, one of our panelist speakers today, as well as myself, are both alumni from the MMI program. We have some great panelist speakers participating in this discussion. As I mentioned, Angus Ho, MMI alum and innovation consultant at Mackenzie Innovation Institute. MI Squared is a leader in the healthcare applied innovation with a focus on ensuring sustainability and long-term success. Ben Su, privacy compliance and strategy lead at Monitio Intelligence. Ran Manor, Director of Innovation at Baycrest, which is home to a robust innovation network with a focus on brain health and aging. Michael Krastowski, Business Development and Industry Relations Manager at AgeWell, a network which develops technologies and services that help aging populations everywhere. It's great to have you all here to share your knowledge with us today. So let's get straight into the discussion. The first question for our speakers is, why do healthcare facilities have innovation departments? What is the goal of establishing these departments? Angus, I guess you can go first.
Okay, thank you. Thanks for having me here on the panel, and also it's great to be part of a panel with a lot of other great minds on the call as well. So I'll jump right to it. Why do healthcare facilities have an innovation department? I think it really comes down to why is there a need for innovation for a lot of, in this case, a lot of healthcare providers. And in the case of, I'll speak, on from the perspective of Mackenzie Health, which is the healthcare provider that MI Square is working out of. We had a mandate to provide excellent care, and roughly even 10 years ago, we had the opportunity to plan and ultimately open up a new hospital in Ontario, Vaughan specifically. And at that point, we had the vision, or the leadership had a vision of, we need to deliver healthcare in a more efficient manner and something that's not the traditional sense. We need to incorporate technology and how technology can enhance clinical care. And this is a key differentiation, because we don't want to use technology to replace humans or people, because care ultimately should be delivered organically, despite what's happening in COVID right now. And with the vision of having smart hospital care, that actually demanded the need for a very agile group of people. In this case, MI Square, we're a pretty small team actually, and in a big organization, and that has allowed us to work with a lot of private sector companies And the way we're set up is actually quite unique, that we're not actually a department. We are a separate entity. So with that in mind, it actually helps us to be free of a lot of red tapes if you were a department, so to speak, and that actually helped us reach out to a lot of companies and talk a lot about strategic partnerships to enable care. And the good thing is that even though we're a separate entity, we do have a good we are affiliated with Mackenzie Health. That gives us a good vision on what the hospital needs, and that kind of agility helps us to explore even things that you wouldn't normally do as a department, I would think. We actually come up with solutions with companies and trial and test it within our sites. We do a lot of internal R&D. So all of these really help us think of new ideas. And sometimes if we fail, you won't know about it, but that actually help us develop new solutions and be very open to share with publicly sometimes on success and failure. And so I think it's the ability to push health to the next level is one of the key things on having an innovation group for our healthcare provider.
Thank you. Ran, I guess you can go next.
Maybe I'll start by saying, caveat to everything I say today, I'm speaking on my personal opinions and not necessarily always what people around would say. And I do think that that's in many ways representative of innovation teams in an institution. We're kind of a strange beast. It doesn't really fit. So your question is great. Why do you need innovation departments? My real answer is that there is no other choice. In today's world, you either innovate or die. Healthcare is not sustainable. When it comes to my case, then senior care is even less sustainable. We take most of the money, by the way, just so you know. So we have to innovate. And I don't think there's a better example than COVID to how innovation drives change. There's a joke about who led the technology revolution, the CTO, the VP, or the president, and the answer is COVID. So in many cases, it's needs-based innovation that drives organizations to bring things. That being said, I have seen my share of innovation theater, and I really don't think that is a valid and good reason for innovation centers to be set up and put in place. If you're thinking of joining one, make sure it's the real thing versus let's just do events and talk about innovation and celebrate innovation. But when it comes to actually doing it, we don't really have the appetite for that. It's much harder to do it than to talk about it, but the need is so clear and we really need to do it. The two things that I would end with is the easiest way to start is by figuring out specific needs that the organization wants, like Angus was talking about, and trying to solve them through innovation. And then having that framework of Abraham Lincoln that the only way to predict the future is to create it. So if you care about what the future of healthcare is, you need to be actively innovating.
All right, thank you for that, Ran. Michael?
Thanks, and yeah, thanks for having me. I think there's some great points there already, and maybe building off of one thing Rand said, it's one thing to have that innovation department there, but you also need to build up that culture for innovation and the capacity for it within a facility and organization, because otherwise you could have, intentionally or not, lip service paid to innovation, but not actually see change brought in. So I think that is an important piece to it. And I think a lot of important points were made. I mean, with innovation, it does address needs, and yes, innovation can bring some significant changes in the facility, which can be disruptive. And I think an innovation department can hopefully and ideally shepherd that, because staff and frontline staff have a lot on their minds, a lot to do, and and you'll need processes in place, you'll need internal champions, and that can't always be the innovation department itself playing all those roles, but ideally it can help facilitate that in some way, so that it does end up leading to meaningful innovation and change. I mean, I know, even with something like COVID coming in, you see facilities bring in technology to have, and like Angus said, and AgeWell feels this sentiment strongly as well. Technology shouldn't be there to replace the human touch, but ideally it's there to improve care and to allow those that provide care to do more of the work that they value themselves and that they find more rewarding, and remove some of the more routine or rudimentary tasks, or in cases like COVID, to increase safety of staff and residents. So, when you do have innovative departments and innovative people in the facility, you can see some of that happening. And I think the one point to add to it is not all healthcare facilities have innovation departments, and sometimes because of that they may suffer. But at the same time, those that do have it, it's almost in a sense incumbent on them to provide that leadership to show the sector that innovation can be done well and can lead to benefits to the patients and the staff.
Great, thank you. Ben?
Thank you very much, everyone, for sharing your insights from the perspective of hospitals and Hospital Innovation Center, as well as the National Center for encouraging innovation in aging care. What I'm hoping to talk about from my perspective is from a private company's perspective in working in implementing innovation in healthcare settings. So just some background knowledge. So we worked on at the start of the pandemic, we worked on a technology that would automate the entire full cycle active COVID-19 screening. And I would say it's a 0 to 1 product, because we never had the need to screen individuals on the scale that we're doing it right now. So from the operational side of things, we found that it's usually very difficult to trying to get all the stakeholders to get their buy-ins from the healthcare facility. For example, we had to deal with the frontline staff, we had to deal with IT managers, we had to deal with compliance and privacy protection side of managers, as well as the ones that are looking into facility management with putting in the necessary wires and Wi-Fi setup that we need in order to run our system. So, but what we found is that by working with clients that had a dedicated innovation department, or someone, or simply just a project leader who is responsible for implementing innovation from the internal perspective, we found that to be very easy getting all the puzzles together, getting all the pieces to the puzzle together, and and get the system up and running. Now, because at the beginning of COVID, I think like everything we experienced was that everybody's doing it for the first time. But I think one positive outcome out of this is that we're beginning to see more and more healthcare facilities to be more, to be better at adopting 0 to 1 innovations. So I think that establishing these departments would definitely help accelerate the adoption of new technologies or processes that would help to improve the quality and quantity of care at these healthcare facilities.
Can I add something, Sarah?
Yeah, for sure.
So I think, just going back a bit to what my colleagues have said, and somewhat to what Ben is saying also, innovation is a tool. It's not the be-all and end-all. It's not the solution or a silver bullet. And we end up having to apologize all the time. And I think both Mike and Angus said technology doesn't replace the human touch. Why do we feel the need to apologize about technology and innovation, and we don't apologize for other things that we bring? what put this in people's mind that if we're innovating, it means that we're replacing somebody? No, we are on this quest to improve, and like need is what drives us. And like the innovation that Ben is talking about is a great example. We needed a solution. It's not instead of people, it's working with people. We're augmenting what humans can do through innovation and technology. And that should be, I think, a normal and a requirement for everything, and not a fear that we harbor somewhere and keep on bringing up. So I don't fear that. I don't think we're replacing people, or we should be thinking in that context. I think we're always looking for solutions, and people should look at it that way.
Great. Thanks for adding that, Ran. All right, so question 2 for all of you. From your experience, what are ways that work most effectively in implementing new innovations in the organization? Angus, you can go first.
Okay, sure. What are the ways? I think one way to answer that is to see the purpose of the innovation group or team or department. Is that it's impossible for just now in our case we have actively 3 to 4 people, maybe 3 at a time, just working on a daily basis, and it's not possible that way. I think the one effective way is that the innovation team should also come up with strategies that align themselves to different departments, and it requires the help of everyone else, the clinical team or even the non-clinical support services team, to actually push the development and implementation of innovations in an organization. In fact, the strategy should be, how can we improve? Or the question might be, how can we push for internal marketing, or how can innovation team become the shepherds to grow an internal culture in an organization? And I find that to be it's a difficult thing. It's actually not as difficult to promote that externally to public. You can fancy it up. You can actually easily convince people there are a lot of cool techs out there. The public consumption, that's easy for them to see something cool, they like it, and then then at that point, the key thing is when they step into your organization, it's actually what you're marketing. And so it takes the whole team, organization wide, and I think innovation team should have that in place, a strategy in that. And some of the ways we do it is we insert ourselves into a lot of our project meetings of other groups. Sometimes we're just sitting there and listening in, and we also make ourselves available as much as we can to tell them that if you have a problem, reach out to us. So a very quick example, what happened was, within our hospital, there was a project that wanted to keep track of lab specimen that going back and forth different departments and now across 2 sites. And we were not involved. My team was not involved at all in the project. Their purpose was simply to make sure we get rid of paper trails, so no booklets writing on tracking where specimens are. And that there was a solution somewhat, but it was ineffective in terms of looking for who is the individual scanning a certain item, and where is it being delivered? Is it in transit? And because I was inserted into different project groups, just listening in, and then I was they didn't know, so I reached out to them and said, how is the project going? And so there's active involvement there, and they said, well, we have implemented a solution with Excel sheets, some laptop, but it's still pretty manual. It's really, you can think of it there. At that time, the solution was simply switching from a paper note to a digital notebook. Not that efficient. So ultimately what happened was we have an engineer team. By team, I mean maybe 2 people that was skilled in software as well. So we took on the task. We said in 3 months, we'll give you a quick proof of concept and see what happens. So we actually implemented a system similar to what you do in FedEx or UPS, scan barcode, have a location set up, and track timing. They liked it. So from there, we scaled it up to have multiple tracking stations across hospital, and then all users are able to access basically like a tracking dashboard and see exactly who picked up, where, and when. And so sometimes And this took more than just us. We have to work with support service, the environmental service, which is people who help move equipments and samples. We work with surgical operation teams. We work with lab teams. So it takes an effort, and it's the idea throughout at least in Mackenzie Health, where be open to changes and always be willing to help out to implement something. Otherwise, if just me and an engineer, maybe one more volunteer, it's not going to work. So I think come up with strategy that works for your organization and have other people become a voice of innovation. And that's how I think can be one effective way for an organization to implement change.
Thank you. Ran?
Well, a couple of things come to my mind. So the first thing, the obvious maybe, is that having champions for every project or initiative doesn't hurt. It doesn't necessarily solve the problem. And as I like to quote a colleague, Pat Clifford, that says, our job as healthcare is typically not to innovate. So having a champion doesn't make everything be resolved, but it does help. Having somebody internal in the clinical group or the group that you're innovating for that understands the problem and wants your help solving it really is helpful. The other thing in my mind is start small. Don't aim to solve everything in the first step. That being said, aim high. So have your BHAG, know where you want to go, as Angus was saying, know the direction, but start it at small steps and figure out small steps to get to that end result. I typically believe in doing more and asking less, being ready to ask for forgiveness, not permission, to doing things in a large organization. It's really hard to get everybody aligned when it comes to a real innovation project. Sometimes it's easier to just start and carve a path and at the same time be ready to fail. So I think some of you mentioned already failure. So like if you're not comfortable with failure, don't be an innovator. It's part of the job and it's actually a very important part of the job. So when you do fail, don't hide it under the rug, highlight it, find the things that made it fail and learn from that failure and embrace it in order to grow. Last thing I'd say, which maybe is the more specific thing that we try to do at Baycrest, is innovate with the groups, not for the groups, or like find a way to be embedded. We have, our role is called innovation partner typically, and we take our team, which is a small team, and in order to catalyze innovation, we embed people in the other groups, because the real innovators are not us. They're the people out there that we have to activate, if you will. We can help, we can facilitate, we can bring methods and skills, and we do training sessions and so on. But at the end of the day, it's finding a way to innovate with the different teams, not against them or for them even. So that's my last piece of advice.
I want to add a quick note to what Rand said. So when I described the tracking project, I said as if it went 3 months, and then 3 months later it grew. It didn't happen that way. One key thing is we did actually pick certain departments that we know have champions that like us, and we used them as an example because they were helping us along. And then after the POC with them showing great success, we also use them to help convince other program team to join in. So it's a process, and obviously other teams didn't know about the errors because we had the failure with the team that let's try it out. So it's not all sunshine and rainbows.
Thank you. Michael?
Yeah, so Ryan, you actually touched on a lot of the points I was thinking of, so thanks for that. Not to belabor the point, I do always agree that having internal champions is valuable, and even if they're not like frontline staff, sometimes I've seen from decision makers or management, people may have a background, let's say in nursing, where they feel there's like a sense of credibility there for frontline staff, and I've seen that help. So definitely advocate for that. I also think, and I'm going to come at this maybe more from the perspective of those that are trying to bring innovations in from the outside, because obviously AgeWell itself, like we fund projects and support startups that are trying to bring innovation into healthcare settings, hospitals, long-term care, and whatnot. So I think it's important to have strong communication between both sides, and that can help in different ways. I mean, first of all, understanding those needs. A lot of times, this is all typical kind of like one-on-one stuff for startups, but nonetheless, you still see it. They come in with the technology, but maybe don't have a full understanding of the need of the facility, and whether the technology properly addresses it as is, or whether changes need to be made. And even understanding the infrastructure. Is everything there in place for this innovation to be implemented properly and scaled up? Unfortunately, we've sometimes seen cases where people have assumed that to be the case, but upon launching the product or whatever it may be, things like Wi-Fi, classic Wi-Fi issue, come into place, and yes, failure is definitely okay, but if it can be avoided or mitigated early on fairly simply, it's always good to do that, especially when at the beginning you're trying to get buy-in from users. Ideally you want to try to mitigate things in a fairly simple way when you can, and then learn from those you can't. And like Ram said, don't hide the failures, learn from them, ask for forgiveness. So, I mean, that's another piece I want to touch on. And the other one is, I agree with Rand's point around starting small. You want to do that and have a kind of a roadmap in place for growing the pilots to a larger scale implementation. But maybe again, this goes back to communication, but having a plan for scaling it up and even reproducing it across departments or other settings. I don't have stats on this, but it's not so rare to see a pilot happen, and even if it goes well, really go nowhere from there because there wasn't a plan in place to scale it up, or maybe the company doesn't have the resources, or didn't really think that through. And that's unfortunate too, because ideally you're not looking for a one-off success story to put out to the public. You're looking for something that's going to lead to meaningful change that can be reproduced elsewhere. So I think those are some other points I would add to the great ones that are already made.
Okay. There is a question from the audience. Can we expand on doing cost-benefit analysis on the innovations that are being considered to be implemented?
So I would like to answer this question because I think, like, from the private companies' perspective, cost benefit analysis, or in another term, value proposition, is, I would say, the core requirement for the innovation to be even considered by healthcare facilities. So Rand mentioned that in order to implement an innovation, you might want to start by getting some buy-ins from the internal champions. So I want to use the story of Monitio, how we implemented our active COVID-19 screening system inside the Northumberland Hills Hospital. So the value proposition, actually, when we communicated, I would say unintentionally communicated to the hospital, was through one of our deployments in a hair salon. So our system was doing full cycle screening for the patrons to the hair salon, and the general manager at the senior home happened to be one of the frequent visitors to the hair salon. So she went through the entire screening process and asked the staff to show, all the screening records, and immediately she understood the value proposition without having anyone to explain it. And then the general manager and her senior home, they work with the local regional hospital, and they recommended to the doctors that were working with the senior residents living in that hospital, and that's how we implemented our technology inside the hospital. So I wanted to talk about this story to say that value proposition, although in this story the value proposition was communicated in an unintentional way, but because the value proposition was understood by the the key opinion leaders inside the healthcare facility, that worked very well in paving the way for the innovation to be implemented inside that facility. So value proposition definitely is another thing. And I think just as important is the concerns that the innovators must address head on, because from our experience in dealing with healthcare facilities from in different sizes, it could be as small as a community care clinic. Medium size would be like a senior home with a few buildings. Bigger size would be a regional hospital. So what we found is that almost everyone they would have some sort of concern, because you are building a 0 to 1 innovation. So one of the primary concerns that they had was, what are you doing in terms of protecting privacy? So we actually at Monitio we prepared a starter pack, the package that addresses the privacy protection and a number of other concerns that these healthcare facilities may have head on. And we, depending on their sophistication, understanding of technology, we provide full analysis of what is it that we're doing to protect privacy. And that eventually has gained confidence of the people that we work with. So I would say working most effectively in implementing new innovation would be communication of value proposition, and also in the way Jesselyn would describe it is cost-benefit analysis, and also addressing the concerns of the healthcare facilities head-on.
I want to add a caveat to that. So it's always tempting to look at value proposition and cost analysis as science. I would claim that while startups and SMEs develop great products, developing the solution is something that happens hand to hand with the health institution. A product is not a solution, it's a product. It's a potential solution. But the real value is how we implement it and how we use it. And attempting to evaluate the value proposition and cost benefit analysis beforehand, to me, sounds typically presumptuous and not accurate at the least. So you can imagine how many people knock on my door saying, we have the best solution for X or Y or Z, and you just need to use it. And if I was tempted enough to believe all of them, I would never get to sleep or to do anything else except bring all these amazing things in. The product is the beginning, it's not the end. Then we have to actually do the work, and it's really hard. And going back to what Ben says, even without thinking about it, what he actually said is what made his product work is the champion. So the general manager that went to a hair salon, that's not a sales pitch. That's a coincidence of somebody seeing the value at work and saying, I believe in this, I want this for my group. And once you have that, that's very different. So I'm going back to champions. Not like cost is important because people are going to ask you about it, but it's not going to get you in the door.
And I'll add to the cost-benefit idea. I assume that you're referring, the question might be referring to the monetary costs and the benefit of it. Sometimes that might not be the case. And the reason is that clinically, in a lot of programs, that in general, there's no budget on the balance sheet that says innovation. So what that means is that we don't have money to spend and buy something. And the cost benefit in this case actually comes from whether it comes from an analysis of the workflow for staff and how does it change or how does it improve the care delivery model, because the budget is there for us to provide care anyway. Does your tool actually ask us to buy more, and then and then in return the company might be using some market data and say it's gonna, there's a market capture of this many, and if you join us now you're going to be part of this. But it doesn't really work that way, and so it doesn't give us the value to consider, is this something. And secondly, I think lots of companies have product and solution, and the way we approach it sometimes is, or most of the time really, is looking at, okay, what are your skill set in this team, your company, and the technology is a good example of what your skill sets are. But more importantly, we would ask you, what is the problem statement you're trying to solve? Don't pitch to us the product yet. Just tell us, what is the question, what is the problem statement you want to address, and then we look at the product to see, okay, so it's an example of how you use your skill set. Now, are you open to actually work with us and using your skill set and say, let's develop a solution? It could be the solution that you're pitching could be the basis for it, but we probably might work something in there and change it and be open to that. So the cost benefit there is also in the case, okay, so there is a cost to this technology, but the benefit is that this team is willing to expand and accept some criticism, and then help us in return create a workflow that can maximize our benefit. In this case, the value of care delivery.
All right, thank you. So our next question for you guys: what are the challenges you observed in this process, and how have you managed them?
Maybe I can start again, or
Well, I was thinking of giving Mike the start, because
Sure.
we take all his answers.
Thanks, Rand. So again, in this case, we see challenges from different perspectives. I mean, because we fund projects typically, or work to facilitate them. I think a lot of this has been covered in different ways, but I definitely think that one of those challenges that happen are those providing technologies or innovations from the outside not having a thorough understanding of really a whole lot that's going inside the healthcare facility. I mean, everything from how they would normally roll out an innovation, which stakeholders to engage with, what their needs are. And I mean, ideally that will come out through some of those early discussions, but when it doesn't, and when people still somehow get paired in or brought into a facility to deploy a technology, all too often we don't see it kind of turn out the way it should. Either there are delays or the pilot fails altogether. So I mean, that is definitely one of the challenges. The other one is really around tech literacy or digital literacy, and that could be, depending what your innovation is. I mean, it could be staff, or it could be residents or patients. Do you have supports in place to increase that, or to ensure that those that are supposed to use your technology are going to feel comfortable with using it? The internal champions maybe could help with that to an extent, but the technology provider should also do that appropriately, put the right thought to that, and understand the process of how to educate people on the technology and support them to use it. Because if adoption isn't there, then ultimately that's going to lead to failure as well. And perhaps related to that in a more broader sense is, I think too often there isn't enough focus on what are going to be the barriers to implementation. And I think that can be addressed to an extent earlier on, in partnership with the customer, the facility, whoever it may be, just to understand what's going to prevent your innovation from being adopted and used to the extent that you're expecting. So, I mean, those are some of the high-level ones. I'm not necessarily going to speak as much from the perspective of the healthcare facility, but I will say that infrastructure is always a key challenge, especially when we talk about long-term care and bringing innovation in there. So I'll just leave it at that.
Thanks. Who would like to go next?
I can try with that. So the challenges from a healthcare provider perspective would be, I alluded to it earlier, it's the amount of funding we can get, because that will limit, and also that will determine how we will approach a project. And because of that, it has actually made us think of different partnership models for us to circumvent or work around those. So in general, I have a $0 budget for any innovation project. That's what the chief, the CFO kind of always come down to it. And at first it might sound like a joke, but it actually is a challenge for us internally first to think about, okay, so, if we're working with limited, let's just say financial resource, how can we circumvent and still work towards that? And at least at MI Squared, the way we often approach is, if there's a company willing to work, we tell them we don't just want to do a one-off and then you go away with your data and then say bye to us. We actually want to work together in a long-term strategy. And one model we often use this, and this is the idea behind, let's say we can't secure any funding from Baycrest, for example, or AgeWell. And so what would happen? We will work and talk to the company and say, okay, what kind of revenue or business model are you willing to discuss and see? Because at first, if the company themselves can't provide or pay for some of our staff effort, which likely they might not be able to, then let's look at it long term. So, first 3 months, what can we do? And after, let's say we help you commercialize and do some co-marketing opportunity, and your product is now gaining traction. If you do sell and commercialize it, can we gain something back in return as a long-term ROI? So we have contributed this much as an initial in-kind. Then down the road, from the business side of things, how can we benefit back from it? At least recover costs that way. So we do talk about a different way. And then when we work with larger companies that are not in the startup state, more of the larger enterprise, we will actually talk about having them to potentially invest in our group, where those funding, those contributions will actually be feed right back into the project deliverables. And in a very brief way, what we do is we set up a lot of strategic goals, deliverables. What do we need to achieve for this funding to be contributed to MI Square, and then and from there we will build out a model that way as well. It's very brief right now. There's a lot more deal to it, but we try to think of innovative business models to work with in the absence of funding, let's say from the government or whatnot. So that's the challenge we have to face and manage internally, and then hopefully sell it back to, reverse pitch it back to company as well.
Yeah, I'll add to that. Maybe, so I'll reverse it, because I agree with Angus. That is a problem. Budget and value is an issue, but it's the wrong issue to have. Like we all have that $0 innovation budget, but doesn't that sound strange to you? Like if we have a real problem that needs a real solution, how do we expect companies to pay for bringing their own solution to our institution? Like, to me, that still is strange, and that shouldn't be the scenario. Like, if we are convinced that it is real, we should find a budget, and it shouldn't come from the clinical side of saying, okay, why don't you fire a nurse and give me the budget of her salary so we can use to bring it. That's not what we're expecting, and that goes to the initial thing. We're not looking to replace people. So if we're serious about innovation as institutions, maybe this is a bit of a self-reflection criticism here, we need to have budget to innovate. It doesn't happen by itself. We can do experiments or pilots, as we like to call them, but that kind of is part of innovation theater if we're not serious about it. If a successful pilot doesn't transform into procurement, then why did we do it in the first place? So I always try to say, let's start with the end in mind. See, let's imagine this is a successful pilot or experiment. Would we buy it? And if the answer is no, I'd rather not do it. So it is hard. I agree that budget is an issue, but it's up to us, the institutions, to solve that problem, hopefully without having the companies pay for it forever, because I don't think that's sustainable. That being said, a few specific, I'd say, advice for the challenges that you asked about. So one thing in my mind is innovation is complicated and in many ways not clean, if to say the least. So people react to it different, and I think people are the key. So if you're an innovation office, identifying who your friends and foes are internally is really critical. And I would actually categorize that more into who are your supporters and opposers, the ones that actually say it, but also who are the bystanders, people who won't help but are still fine, like they'll let you innovate it, versus who are the backstabbers, if you will. So like people who will go behind your back and say why this is never going to work, and they won't say it to you, they'll say it to somebody else that will stop your project. So knowing who the people are, identifying the landscape that you operate in my mind, is really critical. And another challenge is really that balance of knowing when to move fast and break things, like some would say, or when to move at the slower pace but still do things. Knowing when to stay an outsider or somebody that brings change and disruption, but also remembering that you're part of the organization, so you can't really bring too much commotion or making. So finding that balance is what I found, at least, to be critical, and something that becomes a lot of our job, to figure out how much can we disrupt versus accept. So that's my specific advice.
Ben, would you like to expand?
Yeah, thank you. So again, like I'm going to bring an answer from the perspective of technology and engineering side of things. So we talked about funding could be a barrier for innovations getting into healthcare facilities, and so I think that for us, I definitely resonate with what Rand has been saying, is that for the innovators, first of all, we need to do a good job in studying the problem that we're trying to solve. I think like the common mistake for a lot of innovators is that there's a lot of assumptions being made at the drawing board. We assume that the healthcare facility staff maybe experience this problem in this way, and chances are you will be surprised once you start deploying your technology in the healthcare setting. And I think that having the opportunity to validate your assumptions, to test your solution, a little by little, right? Like move fast and break things, but at a small scale initially, to truly understand the problem that you're working on. I think that helps to address, the barriers that you will face in order to scale the product in healthcare settings. So from our perspective is that, now we understood that how healthcare facilities are managing active COVID-19 screening. And our understanding right now is very different from our understanding 6 months back or even 3 months back. We're still learning new things as we continue to expand our deployments inside senior homes for active COVID-19 screening. So I would say, these challenges is, understanding the problem so that you're really working on something that's a solving problem for the people that are trying to, buy your product. And it might be different, as I mentioned before, 0 to 1. The 0 to 1 nature of innovation is that, you really have to basically get internal champions to resonate with you to a point that they're willing to spend real money on the innovation.
Thanks. Okay, and our last question for you guys. What are the qualities that incoming innovation-minded professionals should possess based on your experience? And then for Angus, we have lots of current MMI students watching right now. How did the MMI program prepare you to be ready to take on roles in healthcare innovation? What skill sets are important? And do you have any other tips for those wanting to get into this type of work?
Okay, I will. That's a packed question. I think it's just like a lot of graduate programs. So our students are, especially in MMI, I would say, have been trained to read a lot and to digest a lot of information in a short amount of time. And I think one skill set that comes to mind to be useful is, once you're out there and working, even during the internship period, be very proactive on just reading up a lot on what's happening in the actual quote-unquote marketplace, in this case in the healthcare landscape. And the reason I say that is because your boss, your manager is not going to tell you, oh, well, why don't you go read up something. If that comes to the case, you're probably not doing well anyway, and get ready to leave. But I would say, be very active in research and see what's happening. What kind of, at least in my case, I can give you an example. Be aware of what the Ministry of Health, what new mandates or policies have been pushed out, what kind of funding programs are out. And by learning about that, in return, it helps you guide you when companies come along and talk to you, or when the different clinical programs are setting up projects, where they're coming at. Because a lot of times as a provider, we are responding to what the ministry are pushing out. What are they trying to in terms of care delivery, what type of options are they asking us providers to deliver? And so with that in mind, your ability to quickly think of ideas and adapt to the changing landscape is very important as a student, especially as a new member of the workforce, so to speak. And be open to just accepting requests where, if someone asks you, can you do this? And avoid to say, no, I don't think so. But, within your capacity, yes. And then realize, ask a lot of questions, look for people, expand your network and see who you can ask. And there are people who've probably been in your shoe before. And so don't create something new. I'm sure someone has solved something before or can give you some tips. So avoid working alone. It doesn't work in healthcare at the very least. So, if just like panels like these, meeting people like Rand, Mike, Ben, everybody kind of have a network so you can ask them for advice. And you're not alone in this world, certainly not in healthcare. And so I think these are some good qualities. Be open to criticism, but also proactively work on your own and expand your network. And with COVID, unfortunately or fortunately, it's very easy to network now. You can send emails, set up something, and just chat with them.
Thanks. So what are good qualities that incoming innovation-minded professionals should possess based on your experience? Rand, would you like to go first?
Well, Angus went first, but I'm happy to add. I think he nailed a lot of the things. But in general, I think, again, there's no silver bullet. And I do think that an innovation team is good if it has diversity and it has different people from different backgrounds that bring different skills to a team. But if I have to identify like common things that would be important for everybody, it would be people that are initiative oriented and driven. I don't micromanage my staff. I don't know how to do it. I expect them to be able to take on issues and bring them forward to fruition and understand the value that each project or initiative brings by itself. That's not always easy for somebody, especially somebody fresh, to accept and be willing to do. People need to be egoless, which is strange because, as we said, innovation is a team sport. So we tend to catalyze other groups and other people, but then we want to give them the credit, not take it. So not everybody accepts that and thrives in that environment. And the last thing is that they kind of need to be fighters because it's not going to come easy. So be willing and ready for that element. And I think that's what I look for when I talk to people and trying to understand, are they really in it for bringing impact, or are they looking for a job? There are simpler jobs. So that's my general advice.
Great. Michael?
Yeah, I think Angus and Rand really covered a lot of them. I feel like for us, it's almost like looking like a wish list what we want to see in there. But I did want to add, and this is just really building off what Rand just said, that being proactive and being kind of a consensus builder or catalyzer is really important. Rand had mentioned the different categories of people or stakeholders in your facility that you want to look out for. I think it's important to have those communication skills and that ability to build consensus where you can, but to understand people's concerns or issues as they arise, because if you don't have a good understanding of them, imagine a company coming to you from the outside looking to bring a solution in. I mean, there's a lot more they don't understand, and in the end, you're looking to solve and address those needs. Going back to the very beginning of this discussion, to address some of those key and critical needs, and to do that, everyone needs to be have some good level of understanding of things, and in many respects, it'll be up to you to help ensure that that's there, so that you're not wasting people's time, not wasting resources, and you're more likely to have success. And yes, the startup or SME coming to you wants to succeed from a business perspective, but ultimately everyone wants to succeed in providing a better quality care and service in your facility. And I think that you have a key role in doing that by being proactive and having that understanding, so that you can share the right information with all stakeholders. So throw all of that there.
I would also say I would reverse the first question a little bit too. What good quality should incoming person should have, or candidate? Sometimes reverse it. What good quality should the hiring group also have is be open to consider candidates that are not maybe your normal ideal person in the resume, because in our case, we actually hire engineer students who have zero healthcare training at all. Like, they don't know anything about healthcare. But we know engineers are trained to figure out problems, and obviously, they have to be willing to accept that they are in a role where they might not have seen certain things, but they're willing to learn. And we also there, the team itself is also motivated and encouraged to help these incoming candidates to develop their familiarity with healthcare. And so we do hire students like that, and in that sense, we throw a problem at them. We might not even know, but we kind of break it down, and this is the case. Use your skill set as an engineer in this case to figure out, and then we'll all work through it together. And sometimes, so be open to candidates and a CV that might not even, that there are no health innovation specific program out there, or someone that, there's no such thing. And I think, a lot of us kind of learn on the spot on certain things, and most certainly, it's great that there's MMI program. I do think it's lending itself to train people towards that direction. It's in the name of the program, but at the same time, there's also one way, when I first applied, the employer had no idea what MMI is, so I had to also sell myself to them, why it's valuable. So it's a two-way street as well in this case.
All right. Well, thank you, Ran, Mike, Angus, and Ben, for sharing your knowledge. There was some valuable and insightful discussion and information exchange. If there's any other questions for the panelist speakers in the audience, you guys can ask that now. Actually, we're running short on time, so you can email any questions to sarah.mir@aihtech.ca. So thank you everyone again for joining. I hope you're all taking away some valuable insights which you can apply into your work. We will share the link to the recording once we have it published online, and we will also send along a form to gain some feedback from you all on our session today. So have a great rest of your day, and thank you again for joining, everyone.
Thank you, everyone.
Thank you.